Greater trochanteric pain syndrome (GTPs) is a condition characterized by pain and discomfort around the greater trochanter, which is the bony prominence on the outer side of the thigh near the hip joint. This condition involves inflammation or irritation of the structures surrounding the hip, including the trochanteric bursa, tendons, and muscles. Causes GTPs is often caused by a combination of factors, including bursitis, inflammation of the trochanteric bursa, a fluid-filled sac that helps reduce friction between bones and soft tissues, tendinitis, inflammation or irritation of the gluteus medius or gluteus minimus tendons, which are crucial for hip stability and movement, overuse, repetitive activities or excessive stress on the hip, such as running, walking, or climbing stairs, can lead to GTPs. Muscle imbalances, weakness or tightness in the hip muscles can contribute to altered biomechanics, leading to stress and pain around the hip joint. Trauma or injury, falls or direct trauma to the hip area can cause inflammation and pain. Postural issues, poor posture or abnormal gait can place excessive stress on the hip, contributing to GTPs. Symptoms: the symptoms of GTPs include lateral hip pain. Pain is usually felt on the outer side of the hip, around the greater trochanter. It can be sharp, aching, or throbbing. Tenderness. The area over the greater trochanter is often tender to touch. Pain with movement. Activities like walking, climbing stairs, or lying on the affected side can worsen the pain. Pain at rest. Pain may be present even when not moving, especially when lying on the affected side. Reduced range of motion. Movement in the hip joint may become limited due to pain or discomfort. Diagnosis: diagnosing GTPs involves medical history and physical examination. The healthcare provider will review your symptoms and perform a physical examination to check for tenderness and pain around the greater trochanter. Imaging tests, X-rays, help rule out other conditions like fractures or arthritis. Ultrasound assesses the trochanteric bursa and tendons for signs of inflammation or tears. MRI provides detailed images of soft tissues around the hip to identify inflammation or structural damage. Treatment aims to relieve pain, reduce inflammation, and address any contributing factors. Common treatments include rest and activity modification. Avoid activities that exacerbate the pain and allow the hip to heal. Ice therapy. Applying ice packs to the affected area can reduce inflammation and alleviate pain. Pain relievers. Over-the-counter medications like ibuprofen or acetaminophen can help manage pain and inflammation. Physical therapy. Stretching and strengthening exercises improve flexibility and strength in the hip muscles. Postural and gait training address any abnormal postures or movements contributing to the condition. Corticosteroid injections. In cases where pain and inflammation are severe, corticosteroid injections into the trochanteric bursa may provide temporary relief. Assistive devices. Using devices like a cane or crutches can help reduce stress on the hip while healing. Prevention to prevent GTPs or reduce the risk of recurrence. Maintain good posture. Ensure proper alignment during activities to avoid undue stress on the hip. Regular exercise. Incorporate strengthening and stretching exercises for the hip muscles into your routine. Gradual increase in activity. Increase physical activity levels gradually to avoid overuse injuries. Proper footwear. Wear supportive shoes that provide adequate cushioning and alignment. Weight management. Maintain a healthy weight to reduce stress on the hip joint and surrounding structures. Conclusion: greater trochanteric pain syndrome is a common condition that can significantly affect daily activities and quality of life. Early diagnosis and appropriate treatment, including rest, physical therapy, and lifestyle modifications, can help manage symptoms effectively and prevent recurrence.